Very good evening to all of you. Today is a special day for Eclectica. And you can see Dr. Sandra Coulson with me. Very welcome you, ma'am. Thank you so much for accepting my invitation for this show today at Eclectica.
It's my pleasure.
Okay, so just before we begin, ma'am, I would like to introduce you to my audience. So here I go. So Dr. Sandra Coulson is popularly known as Thumb Whisperer by thousands of her patients with whom she has worked over the past 53 years. And she has a success rate of stopping thumb sucking of 99.7% on the first day, and ma'am knows what works. So she is as a speech therapist. She has a master's in health sciences, and she had successful multi-office practice in the Denver metro area, specializing in orofacial myofunctional therapy. She owns the Coulson Institute of Orofacial Myology, where she teaches dental hygienists, speech pathologists, dentists, and other qualified professionals who want to specialize in this field. And she also teaches and lectures in many universities and institutions internationally and have been a professor of orofacial myology. She says her personal goal is to provide the best possible therapy for her patients and to educate more therapists who will help more patients every year. Uh, with her efforts, she changes the lives of her patients through simple exercises designed to correct tongue and lip patterns that might have created dental, orthodontic, and cosmetic problems. She also has is going to bring up a book named Faces, which will be released soon. This book is for parents and professionals to recognize some of the patient's issues and encourage early treatment. Once again, welcome, ma'am, and I think we will have a very interesting conversation today.
I do too. Great. Thank you.
So, ma'am, going to the first question to you. It is very interesting when actually I read and I came to know this fantastic name that you have, which your people call you Thumb Whisperer. So, I would like to know that why, what does this mean, and why do they call you so?
Well, um, after I evaluate a patient who either sucks a thumb or a finger, I start them on a one-page program that they go home and never suck again. And it's just, I developed it and it just works because these kids are mostly, not all kids, by the way, many adults, but they all seem to have airway dysfunction. And when you get the tongue into a good posture, then you get the lips closed, they start ease of breathing, and it changes their lives.
Very interesting. Very interesting. So, ma'am, I'm going to my next question, which is it is a query, you can say that we heard hearing about orofacial myology and speech therapy. So, the first part of my question is that what are orofacial myology and speech therapy, and how are they related to each other?
Well, my background is speech therapy, um, but I worked in dentistry as a young person too with my best friend's dad, who was a dentist, and then I married an orthodontist, but that didn't play a real role in what I do. As a speech therapist, what I saw was that things didn't change very quickly. And I have a big background in muscles. I'm a figure skater, gymnast, dancer. And I decided that what had to work were the muscles of the face, lips, jaw, tongue, head posture, body posture. And that's the way I developed this course so that it's not just put your tongue up and keep it there because it doesn't work.
Mm.
And flashing a group of cards to a child and having him say the same word over wrong a group of times only reinforces that wrong word. So I just decided I needed to develop the musculature so they could use the muscles and do and speak properly and breathe properly.
Amazing. Fantastic, ma'am. This is so inspiring to know right from you. I mean, the person who has actually bring this thing as a subject altogether. It is very useful to the society and to everybody as well. So, ma'am, as we know, you have an institute and you have been extensively working in this from I think almost more than 53 years, like we know that. So, please tell us more about your institute, that is the Coulson Institute of Orofacial Myology.
Right. I developed it when I just didn't see other
Mm,
courses encompassing
mm,
everything that needed doing. So I started training people to take measurements and good photographs and make certain that their posture was good and that breathing had changed. So when I develop my school,
mm.
it just seemed logical that someone needed to train therapists to look at more than just tongue thrust.
Yes. So, ma'am, when you started this institution, like in a very formative way?
Oh, 2003.
Oh, that's long back. That's long back.
Yeah,
Yeah.
everything I do is old, but I, I've been around a long time. But I'm also creative, and I'll take a step where lots of people do that, and that's made it especially
Yes. So, ma'am, f- uh, what was your exact inspiration behind initiating this institute? That is the Colson Institute of Orofacial Myology. What was your inspiration?
because doctors kept sending patients to speech therapists, and
Hmm.
speech therapists are not typically trained neuromuscularly. And I would get those patients later after the parents had spent fortunes on 5 or 6 years of therapy, and the kids were still saying "park the car" instead of
Right.
"park the
Mhm.
car." And I decided it was time to train some people to do this in a way that made change.
Hmm. Fantastic, fantastic. So that means your patients actually are the inspiration behind all these training programs, or I can say that the insights from your treatments or the type of patients you have been seeing and treating. From there, you came up with this entire idea of training and your institute. Am I right, ma'am?
Absolutely.
Okay, okay, that's really really is so inspiring and so encouraging for all of us. So, ma'am, I have one question, that is, uh, like you said that you train many kind of clinicians as well. So can a dental graduate specialize in the field of orofacial myology? Is that possible?
Well, there are no degrees in it per se. So
Mm-hmm.
it's just like taking any course that you go to take outside dentistry. Um, Hopefully, someday there will be, but it's not in the near future. I tried to do that through university, but the the cooperation wasn't where it needed to be.
I understand. Yes. Okay. So it's more like we can add an skill. It's more like a skill addition program where we can learn and we can implement it in our clinical practice, right?
Implemented into dentistry, at least to recognize what the
Yes,
issues are, and then have someone to refer to mitigate what's happening. That's a big
exactly.
issue.
Exactly. So, ma'am, as you said that regarding this program or your institute, I understood that even a general dentist, like a dental graduate, can definitely understand and learn from this about this specialty, and they can implement it. So,
Oh,
in this regard,
so,
can you please tell us more about the training courses that you conduct in this field?
right.
And yeah, okay,
It's right now. I've done 100+ hour courses. I've done 72-hour courses, but I've peeled it down to a 36-hour course done every other weekend, and um, that gives the doctors or the dental hygienists or speech pathologists time to develop a patient load three
you're
or
right.
and then actually see the progress, because with the measuring that we do in the model that I've set up, it's pretty easy to follow and see what the changes are very quick. Like a filter will change 2 to 3 millimeters in a week.
This is amazing. This is
We
amazing.
get a kiddo with Down syndrome to put his tongue on the spot in his mouth instead of
Mm,
there. It's just
exactly.
beautiful. And
This
it's
is beautiful. Yes, I agree. So, ma'am, obviously, a very pertinent question that is running in my mind, and I'll ask you that. Like, if somebody from India wants to access your course, how can someone from India get access to your courses?
you just go online to the Coulson Institute, and
Okay.
I have someone who manages that, and
Okay.
she gets back to you, tells you when the courses are going. I teach an intro. Um, Sometimes I'll teach a middle course as well, but always an advanced course. I do a lot with TMD and
Okay.
with snoring and sleep apnea. I like
Mm.
people off of CPAPs.
Yes, I think this is a very, very, very promising area, and at least some awareness has grown over the years in these aspect, because it was not considered like dental professionals could even treat this problem, but it is very much related to our entire area that we deal with.
Of course, of course.
Yes. Right, ma'am. So that's very nice to know, ma'am, that it is your courses are very much accessible. So definitely to all my viewers, I would say that you go and visit the website, and in the description after this video, I'll put in the description the website also. So if you're interested, you can go and see Dr. Coulson's website of the Coulson Institute of Orofacial Myology, and you can definitely get access to all the training that ma'am is conducting. Okay, ma'am. So my next question is that uh, which we at least we hear, I come commonly hear, and it's a trend that is running, that people say that dentistry is saturated, and the field is, it seems the field is losing scope. What is your opinion in this?
Well, if you come to Denver, there's a dentist on every other corner. That's
Uh-huh.
true. And I believe that's true. So those who specialize in certain things certainly do better. A good general dentist, of course, is valuable like
Hmm.
crazy. But um, yeah, I believe it's being saturated, and mostly by females, which I'm not opposed to. But it's becoming a huge issue. When I
Mm.
lecture at dental schools, typically it's a greater percentage of females. And the sad thing is, they do dentistry for a short time, then they decide to have a family, and
Yes.
they move along, and sometimes they marry a dentist, which is great. But unless they have a particular
Mm.
affinity for some part of
Mm.
dentistry or they specialize, um, they I have so many in my practice who come to see me for tongue tie or that kind of thing,
Mm.
and they've just quit their practice. So it makes me sad being married.
But I think, ma'am, the kind of area you have brought up through these years, the training that you have brought up, even yes, as I agree with you that you said that specialization gives a little bit of better position to a particular practitioner. But I think even a person, I mean, a general dentist, a graduate who is, trying come out fresh and they are trying to step into the market. So if they have this kind of knowledge, obviously it helps in the branding of that particular clinic.
Absolutely. Well, they'll notice things that a typical
Hmm.
graduate does
Hmm.
not see, nor was trained, because
Yes,
they don't train this in dental.
exactly, exactly. Yes, ma'am. And I think we are almost at the end or concluding part of our conversation. So obviously, this is a very obvious question for you, the last one, that what would be your message to aspiring dental professionals?
Just don't stay focused on the old phrase drill, fill, and bill. Um, is there has to be a broader experience, whether you're looking at airway or tongue position um, ortho in a number of ways. I think you have to be more forthcoming with your opportunities and just grab what's available to learn, because there's so much going on out there now, and there's both good and bad. But if you expand your knowledge, you're going to be such a much better dentist for your patients.
Absolutely. That is wonderful. I think that is enough dose of inspiration that I think whoever is listening to us right now, or whoever will be listening to this conversation in a recorded version, because this is definitely going to stay in my channel forever. So thank you so much, ma'am. I know how busy you are, and it's a working. Yes, it is a working day for you, I guess. So because here now it's night time, but I think it's Friday morning there. So
Yes,
in spite of your busy schedule, you gave so much time to for this conversation. It was wonderful meeting you and knowing you, ma'am.
a pleasure to get to know you, and I hope to see you in person sometime soon.
Okay,
Thanks.
thank you, ma'am. Bye bye.
Stay well.
Same to you, ma'am.